Our pain receptors send signals to the brain that something is happening in the body that ought not to be. The issue is not really the pain. The issue is actually that underlying factor of something not working properly. But most of the time as humans, what we do is we focus more on the pain, which is just a symptom of the real thing. We focus more on the pain, that's why we get pain relief. But when you take the pain relief and it elapses, you relapse back into your former condition. Now, beyond physical pain, we have psychogenic pain, and that could be more dangerous because a lot of people going around are walking, they are doing what they are doing with one psychogenic pain or the other. That, and the worst case scenario, could lead to deep depression, which could eventually lead to suicide. You know how many people will listen to suicide every year, but this can be addressed. A psychogenic pain might be a pain of regret, a pain from a divorce, pain from multiple failures, from disappointments, and it affects us emotionally. It reduces our efficiency. In fact, at times it reduces our existence to mere survival. And this is caused by this psychogenic pain. So how do you handle psychogenic pain? You should take good care of yourself and never let the psychogenic pain accumulate to the extent that it leads you into depression or giving you the opinion, the option of committing suicide. There are various ways you can attack psychogenic pain. The first is to go for therapy. There's something called CBT. CBT means cognitive behavioral therapy, who look for professionals in that field to help you. Secondly, you could learn how to manage stress. Accumulated stress at times leads to psychogenic pain, which can be detrimental to your existence. So learn how to manage stress. Three, you can treat psychogenic pain through medications. You could consult a physician. They will recommend some antidepressant drugs for you that you can use to balance the hormonal dysfunction. There are some exercises that can be recommended that will help ease the psychogenic pain. And also, you could try the holistic approach, which is yoga, meditation, and all the likes, where you keep your mind at a state of rest, at a state of silence. You keep your mind at a state where noise is an alien vocabulary. Then lastly, you could look for support groups, people you trust, people you can share this pain with. Once you lift off this burden by sharing the pain, you reduce the effects of the pain. But most importantly, beyond the pain you feel is the underlying factor. There are some things that you need to deal with before we enter 2025. There are some things you need to forget. There are some things you need never to remember again. And the good news is you can do it. You can do it. The rate at which you will be effective depends on the rate at which you remember and you forget. And it has to be intentional. You forget some things to remember some things. And don't mind if you try your best possible and the thought is not leaving you. It would eventually. You only need to try more. Take care of yourself. Don't let this lead to depression. And don't even consider the option of suicide. For if there is life, there is hope.